A needle and syringe are used to administer injectable dosage forms. Injectables are often referred to by the type of container in which the drug is supplied. For example, ampules are dosage forms in which the drug is contained within a small, airtight, thin glass bottle that is opened by snapping the narrow neck of the ampule bottle, Figure 110. Drugs contained within ampules typically do not have preservatives, therefore, the entire contents of the ampule are intended to be used at one time and must be filtered to remove glass particles created when the neck is snapped. Vials are thicker glass bottles with rubber stoppers through which the drug is withdrawn with a sterile needle and syringe. Vials may be multi-dose vials, in which multiple doses can be withdrawn over time, or single-dose vials, in which all the drug is used at once. Most injectable drugs in veterinary medicine come in the multi-dose vial form. The single-dose vial is most commonly used with vaccines. The rubber stopper on multi-dose vials should be kept clean to prevent inserted needles from carrying bacteria or contaminants through the rubber stopper and into the vial. In addition to the standard injectable dosage form, injectables can also be classified as repository or depot forms. This dosage form is formulated to allow a slow absorption of the drug from the administration site, providing more sustained drug concentrations in the body over time. Typically, depot injectables are oil-based injectables that do not readily dissolve in the water-based tissue fluid or are manufactured so that the active ingredient is formed into crystals that take longer to dissolve and release the active ingredient. Implants are a special type of injectable repository dosage form in which a solid object containing the drug is injected or inserted under the skin. Once in place, the implants are designed to dissolve or release medication over an extended period, weeks to months. Where can a veterinary technician find accurate drug information? With the advent of the internet, a good deal of information on veterinary drugs can be obtained with a few keystrokes on the computer. However, there also exists a great deal of misinformation regarding veterinary drugs. Veterinary professionals must use only drug information that is supported by clinical research and extensive testing and regulated by the appropriate watchdog agencies, e.g., FDA. Unfortunately, for many so-called minor species, e.g., sheep, goats, llamas, wildlife, zoo animals, and many laboratory animals, there is very little clinical trial information or solid medical evidence on the safe and effective use of veterinary drugs. In those species, much of the information is anecdotal or based on the experience of veterinarians working with these species. Although this anecdotal information is sometimes the only available information the veterinarian or veterinary technician has for a minor species, one must remember that this information has not undergone the rigorous testing or clinical research required to be an FDA-approved veterinary drug. Label and extra label information. Generally, the most accurate drug information for a particular product, including the most recent changes in the drug formulation, dosages, or warnings, precautions, will be found in the drug insert or package insert, which is the manufacturer's documentation inserted into or attached to the side of each bottle, package, or box of medication. The drug insert will contain the information that is mandated by FDA regulations for veterinary drugs, but will only contain that information for which the manufacturer has done the mandated testing or otherwise documented in compliance with FDA requirements. Thus, this information in the drug insert or package insert and printed on the drug label would be considered to be the label information. Unfortunately, advances in clinical veterinary medicine typically occur much faster than a manufacturer can complete testing and receive a new drug use approval for an existing drug. Indeed, it is often not cost-effective for a drug manufacturer to spend the thousands to millions of dollars to get FDA approval for every new use, new means of administration, new species use, or new dose for their drug. Instead, veterinarians often use drugs in an extra label manner, meaning they are using the drug in a manner other than the FDA-approved dose, route of administration, disease, condition, or species listed on the drug label. Extra label or off-label use of veterinary drugs is permissible by federal law under certain circumstances. However, because of the potential threat of veterinary drug residues finding their way into human food or food products, the FDA regulates how drugs can be legally used in an extra label manner.